to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And our first order of business is the presentation of payroll, most recent, for November 25th.
Mr. President, I'll make a motion we approve that payroll as submitted.
Second.
We have a motion and a second to approve the payroll as submitted for November 25th. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed? Motion passes. Okay. Turn it over to council for the opening of bids, receiving of bids for our Tippecanoe County Central Office Phase 2.
First one appears to be from Wagner Electric. $100. Alternate 1 is an addition of $23,183. Next we have Spencer Construction Company, again General Trades 2A. With a base bid lump sum of $689,400. Alternate 1 is an addition of $33.45 each. Next we have, looks like millwork casework. One in that package from Deerwood Group. That's 2B millwork. The 2D is 2B.
2B is in boy.
With a base bid lump sum of $89,643.75. Got hollow metal frames, doors, and hardware. This is from Mall Hops. And 2C, hollow metal frames, doors, and hardware. A base bid lump sum of $231,586. And no alternate. Floor coverings. First from Jack Laurie Floors. And that's 2D floor coverings. With a base bid lump sum of $198,700. Next is Blakely Corporation. It's also 2D floor covering with a base bid lump sum of $215,625. Paint. So this is 2E, painting and wall coverings, Anthony Anderson Corporation. With a base bid lump sum of $77,900. Alternate one is add $1,500. Next we have Bill Lawrence Company, also 2E, painting and wall covering. With a base bid lump sum of $72,300. And alternate one is an addition of $250. Also 2E, painting and wall coverings, Heritage Classic Construction. With a base bid lump sum of $65,500. And alternate one is an addition of $1,200. Next is Fire Suppression. $2F Fire Suppression from Renewal Company. With a base bid lump sum of $124,960. This is also 2F Fire Suppression. Let's see the name on the outside. Smooth. This is from Brenico with a base bid lump sum of $149,124.81. Plumbing. This is 2G Plumbing from D.A. Dodd. with a base bid lump sum of $237,000. One's also 2G Plumbing. It's from Quality Plumbing and Heating. With a base bid lump sum of $189,000. This is heating, ventilating, and air conditioning. Bid package 2H from Wright Hardware Company. With a base bid lump sum of $286,249. This is electrical. So it's 2I electrical. This one's from Houston Electric. With a base bid lump sum of $388,320. And alternate one is a deduct of $753.
Doug, can you repeat the base bid?
Yeah, so Houston Electric 2I electrical base bid, $388,320.
Thank you.
This one's from Long Electric. With a base bid lump sum of $653,580. Alternate one is a deduct of $1,000. This one's from Brand Electric. Again, these last few have been for package 2I electrical. Not sure if I said that. And the Brand Electric, Brand Electric base bid lump sum is $423,900. And the alternate is a deduct of $1,100. Next one's from Fissel Electric Service. A base bid lump sum of $544,800. Alternate one is a deduct of $1,900. We got fire detection and alarm. This is 2J, first one from Renewal Company. With a base bid lump sum of $27,435. Next one is also 2J, Fire Detection and Alarm, Houston Electric. With a base bid lump sum of $28,712. Next is 2J Fire Detection and Alarm from Mulhops. With a base bid lump sum of $22,185. Next one is 2J Fire Alarm from Brand Electric. With a base bid lump sum of $21,450. We have Site Excavation and Utilities. This is 2K, Site Excavation, Reith Riley. A base bid lump sum of $245,693. Also 2K Site Excavation from Davidson Excavating. With a base bid lump sum of $297,903. Also 2K Site Excavation from Fairfield Contractors. With a base bid lump sum of $197,973. That's everything.
That's everything. Well, thank you to everyone who submitted bids for the project. And with that,
I'll make a motion, we take these bids under advisement.
Second.
we have a motion and a second to take the bids under advisement. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Aye. And opposed? Motion passes.
Have a happy Thanksgiving, all. Thank you. What was the very first one on the combo bids? It was the very first on the combo when we first started. You didn't catch that one either? You had Houston, but there was somebody right before Houston. Two I and 2J for the combo
All right,
bids.
we will move on to our next item of business, Resolution 2020-30-CM, renewal of the Syringe Exchange Program. Doug?
Yeah, so there's a lot of words here, but in essence, it's just as presented, the resolution would renew the syringe exchange program for 2 years. The initial formation of the program requires a public hearing. The extension technically does not, but I think, I think you generally take information every couple of years to see if you want to keep it going. So this would take it out till December of 2022 if you passed it.
It's my understanding that there is also a sunset provision in the state law, so there could be something that changes yet in 2021. Is that, am I right in that?
I do not recall that.
Yeah, I'm not, oh, yeah, no, so this chapter expires as written July 1st, 2022. So I guess it's unclear what would happen if that chapter expired and you're still out till December 2022.
So the state would have to reenact it, basically.
I mean, I think so, but I don't know that you would have to. I'd have to do more research to know whether your current resolution makes the syringe exchange program illegal if that chapter expires and the state doesn't do anything one way or the other. So you've got this dead letter here Does that make your existing program illegal after July 2022? I'm not entirely sure, but you couldn't extend it any further. That I could say for sure.
And I see our friends from the health department are in the audience, and I see a lot of nodding heads, so I think they may be addressing that, at least to the best of their knowledge, during their presentation. So anything else, Doug, before we hear from Dr. Adler and the public on this?
Nope.
Okay, so what we would like to do now is go ahead and turn the program over to Dr. Adler.
Good morning.
Morning.
Thank you for inviting us to your meeting and giving us the opportunity to share our syringe service program data. On the screen, I have a short presentation summarizing our syringe service program data from the program's inception in August of 2017 through September 30th of this year. As a reminder, our program is called Gateway to Hope. It is a harm reduction program. It is an evidence-based response to a local public health emergency due to rising hepatitis C infections in our county. The goals of the program are to reduce new cases of hepatitis C in Tippecanoe County, prevent an HIV outbreak in Tippecanoe County, provide safe disposal of syringes, and importantly, serve as a path to treatment by linking participants to drug treatment, healthcare, and social services. This past February, our program was able to move from the Health Department's 6th Street office to the Lafayette Transitional Housing Center located at 815 North 12th Street. At that location, the program operates on Tuesdays from 3 to 6 p.m., Fridays from 1 to 5 p.m., and on the third Saturday of the month from 10 a.m. to 1 p.m. We also have a mobile site that typically runs at the IU Arnett Clinic on Greenbush Street. That site has been on hold due to the pandemic. It's simply not possible to social distance in the mobile unit. This year we did also acquire a new mobile unit that is used not only for this program but for other health department initiatives. So we're very grateful to the commissioners and the county for assisting us in obtaining this valuable new asset. This slide summarizes our syringe distribution and collection data. This is cumulative data from August 11th of 2017 through September 30th of 2020, involving a total of 524 participants over that period of time. This slide has a lot of numbers on it, and I'd be happy to go through those numbers in detail, but I'll just point out a few points here. First, in blue are the total number of syringes that have been distributed through the program since its inception in August of 2017, and that is just over 97,000. In red are the total number of syringes collected, over 143,000. Below each of those numbers is a breakdown of syringes given out to new participants and returning participants, and then also in the collected category, those collected from new participants, returning participants, and those collected through our community drop-off program, where individuals can turn in used syringes that do not originate as part of our program. At the bottom of the slide are two calculations of return rate. One is in gold and one is in red. The number in gold is simply the total number of syringes that we have collected divided by the total number we've given out, and that value is 79.7%. After that, you see the various values of that over time. At the bottom of the screen in red is a different calculation of return rate. This is the calculation that the State Department of Health uses for these programs, and it involves just the return rate of, return rate for returning participants, and that number calculates to be 91.4%. The state's benchmark for this figure is 80%, so we remain well above the state's benchmark for return rate.
Just go.
Yes.
So a quick question, a syringe equals the same as a needle. A needle and syringe is all in one
Correct.
unit.
Yes, one unit.
Okay.
Yes.
All right.
And Dr. Adler,
Yes.
on the top percentage there, the 79.7, do you know where we compare to other programs across the state in regard to that rate?
For that rate? Yeah. Do you know what the other programs are?
I would
Yeah. Yeah, the second number is usually about 80 for the most. Okay. As I mentioned earlier, our program also provides other valuable services to our participants. One of those is testing for hepatitis C and HIV. So far, we've been able to test 65% of our participants for hepatitis C and 68% for HIV. These percentages are lower than they have been in the past. Because of the pandemic, our testing has not been as high as it would have been. There was a period of time at the beginning of this year where we were not able to offer testing because of the pandemic.
And it's typically, are those tests a requirement for participating in the program?
They are not a requirement. They are offered and strongly recommended to every participant.
And it can't be mandatory that they have to do this to be able to be in the program?
I believe the State Department of Health will not allow us to mandate that as a condition for participation. This slide shows some of the other valuable services that the program provides. As I mentioned, we want the program to not just be a syringe exchange, but also be a linkage to care. As such, the program does provide other services to participants, and this slide summarizes those services that have been rendered, including substance abuse treatment. We've had hundreds of referrals to those programs. Mental health services, we've provided over 1,400 doses of Narcan to our participants. We provided STD testing, insurance navigation, immunizations, and assistance with housing and food, in addition to a safe injection handbook. So we think these are very valuable parts of our program that make our program more of a comprehensive public health approach to this problem rather than just a syringe exchange program.
So, if you don't mind, we keep going.
Sure.
You got 560-some participants, but we have 600 and some for substance abuse treatment. Is that people maybe not participating, but are at least getting directed towards treatment?
Correct. And that's correct. And often in the world of addiction treatment, people often have to be referred to treatment programs repeatedly. It doesn't always take on the first go around. Yeah.
Thank you.
So that's why that number's higher.
Do you, like, of the 524 that are currently participants, or I guess those are participants since the initiation of the program?
Correct.
How many are currently active?
Active. Okay. Amanda's pulling that up right now. Okay. One of the other things that we've done as part of this program is a community cleanup where we have a team of volunteers that go to various neighborhoods in the community and search for dirty used syringes and pick those up. Because of the pandemic, this group was only able to do this during the third quarter of this year. That photograph there is from 2 years ago, so pre-pandemic. That's why there aren't any masks or social distancing there. So far, since August of 2017, our volunteers have found 15 syringes, 2 of those during 2020. They have, however, picked up over 120 bags of garbage, 30 of them this year. This next slide summarizes our new chronic hepatitis C cases in Tippecanoe County going back to the year 2013. And as you can see, there was an increase, a steady increase in those cases up until 2017 when the program started. And then you can see the numbers for 2018 and 2019. This year, 2020, the number is quite low. Part of that is because of the pandemic and the reduction in testing that has occurred. 32 cases confirmed. In the footnote, you'll see that 49 cases are still open. So that number 32 could increase to 81. And then in addition, there will probably be some cases diagnosed between November 10th and December 31st. So we do expect that number to be higher, but part of the reason it's lower is because of the pandemic.
So define open cases.
Sure. So when somebody is tested for hepatitis C, the first test they receive is an antibody test. and that test does not differentiate between acute and chronic hepatitis C. They have to have further testing done. And so these open cases are folks who have not had that testing done, so the investigation is not complete at this point.
Okay, so none of those 49 are included in that 32?
No,
Okay,
no.
okay.
But if they do become confirmed cases, then that 32 would go up to 81.
And do you know of those 32, how many were identified through Gateway to Hope?
We did, I think it was 13 hepatitis C tests this year. Is that right, Amanda, in the program? Yeah. Okay. Yeah, so we did 13 hepatitis C tests as part of the program, and we'd have to look and see how many of those ended up being positive tests.
Those 32 most likely are from your first 3 months of the year, if you want me to be honest. There's still a lot of pending.
Kayla, could we have you step up to the microphone, please? Thank you.
There's still a lot of pending investigations that haven't even been started yet, because the staff that normally, so usually IPUI students help with the Hep C cases for ISDH investigations, and right now, everyone's response has been COVID-19 investigations. So there's still a lot of investigations that haven't been done. That's why I really think that 32 is probably honestly from the first 3 months of the year.
But it would make sense that that number be constantly decreasing, right? Because you're
Because
going,
the program is working, correct.
I mean-
Now, I do want to say that this was going to be I'm not trying to, Hep C right now, we are finding more Hep C cases this year in COVID-19 patients. Hepatitis C also causes stomach issues. COVID-19 causes stomach issues. When you do your COVID-19 investigations in the state database, I am noticing quite a few of the investigations, when I've been doing them myself, have Hep C. So there hasn't been any studies on that yet. I brought that up to state and other SSPs, but right now we're just trying to survive the pandemic. So eventually that'll be studied, but we are seeing more Hep C. I do feel like from the COVID-19 is causing damage to the liver also, and then they're getting further testing and it's leading to Hep C testing.
but wouldn't it make sense for that number to be decreasing as well? Because we have tested a majority of the folks that are in the program in previous years?
Correct.
Exactly, okay.
Kayla, one follow-up question. So clearly, I think the pandemic has impacted your ability to do as much testing, and I'm going to guess has it also impacted the number of people that you have coming to you for service, or is the impact strictly on the health department side?
It's impacted the amount of people that were able to get into treatment. If you want me, I mean, it's impacted the services we're able to provide the people. A lot of times for recovery house, they want you to be isolated and quarantined for so many days before you can get into that recovery house or get into that treatment center. Well, when someone decides they want to go to treatment, we need to get them into treatment today. And with the pandemic, we're just not able to do that. So that's delayed. It's delayed our testing. We didn't test the immunizations. Usually I'm there giving immunizations every Tuesday and Friday. I haven't worked Gateway to Hope personally since April. So it hasn't, the services in linkage to care are decreased this year because of the pandemic response.
What, in just your sense, the information that you showed a few minutes ago about the number of syringes found through the process, any communications from law enforcement about what they're seeing in terms of those? I know early on, obviously, your staff were doing a great job of monitoring the neighborhood around our former location at 629 North 6th Street. And plans are to continue to do that around
so Grace has been, which is our recovery coach, has been doing that this year. We didn't do it during the shelter in place, and we stopped it 2 weeks ago with our surge. just because I don't want a whole bunch of my staff and volunteers together to do that right now, and we're kind of using all our staff for the pandemic response. I mean, Grace right now is not here at 10 o'clock for this meeting because she's driving someone to be tested for COVID-19 in our mobile unit, so, yeah.
Thank you.
Yep. Our active participants for the last quarter was 77. We do it by quarter, so for July 1st.
Could we get it to the microphone? Thank you.
So for the third quarter, our active participant number is 77. Those are participants that were active during that quarter, so July 1st to September 30th.
Thank you. This next slide shows our new HIV cases here in Tippecanoe County. We've been very fortunate as a county to have relatively low HIV numbers, and one of the purposes of this program is to keep those numbers low. So for this year, through October 31st, we have had 13 new HIV cases, which matches up with 2019. So we'll be watching this number, of course, very closely. So to summarize, the goals of our syringe service program are to reduce the new cases of hepatitis C in Tippecanoe County, prevent an HIV outbreak in Tippecanoe County, provide safe disposal of syringes, and serve as a path to treatment by linking participants to drug treatment, healthcare, and social services. And we think thus far our program has been accomplishing these goals, and we respectfully request renewal of our syringe service program. Thank you. I'd be happy to answer any additional questions.
Any additional questions for Dr. Adler or staff?
Yeah, with the potential health department moving out to the old Y, are you still looking at keeping the syringe exchange at transitional housing and not moving it out to there?
Yes,
So
that would be the
you're
plan.
still looking at the same program you're currently doing accordingly?
Correct, that would be the plan. Eventually, the pandemic will end and our mobile unit will be used again, and that could open up additional sites for the mobile unit. But the plan is to have the main site continue to be at the Lafayette Transitional Housing Center.
Okay, we're giving us success rates of 90%, 70% returns, this, that, and everything else. How many people we've saved? How many who have gone to do treatment? How many that we've gotten into the doors and we can pat ourselves on the back and say, because of this program,
Okay.
we saved some people?
From September of fall of 2019 to August 2020, Grace has seen every participant that's walked in the door and done counseling. And then 84 people have been referred during that time frame to treatment or mental health services, and sometimes both, because we understand that there's multiple paths to recovery.
And
And
Kayla,
then-
I'm sorry, what was that time frame?
Huh?
What was the time frame there?
Fall of September of 2019 to August of 30th of 2020.
Okay.
And
So
then-
those numbers would, I'm sorry to interrupt, those numbers would be included in the 603 number?
Correct.
Okay.
I just broke it down this morning at 9 o'clock
Okay.
to give you a little bit more. Yeah,
What was that number again?
84 people. And then 12 people this year are in active recovery for 2020 that I've been able to identify that are still in active recovery.
In your gut opinion, those 12 wouldn't be there if they hadn't come through this program?
I think more than 12 would not be there. You know, if the pandemic wasn't going on right now, I would have pulled people that have been through our program and been successful today to be here, because not only is the 12 people that are in active recovery, but we've given out 5,000 doses of Narcan since the SSP started that we would not have access to without the syringe service program. We've given out 1,000 doses to law enforcement. So not only do we have those people in active recovery, but also we've saved countless lives by having the Narcan available. And if you don't have Narcan and you can't breathe today, there's no point in recovery. So,
So
I
that's,
mean,
the Narcan program's only available because we do have
through the
it?
syringe exchange program, the
It has
grant
to be-
funding through that.
And that's true for the what's being given to law enforcement too?
Yes. And over 1,500 doses have been given out to the SSP, the Syringe Service Program Gateway to Hope. Any other?
And that's still in that same time frame.
Yes, correct.
And that would,
I'm sorry, that's the Narcan is the whole time. I didn't break it down to the last year. I'm sorry,
so
Tom.
how does that differ from the 1441 that's in the report?
Because the 1441 is,
The-
that's
through-
Narcan,
And that's through September 30th.
and then mine goes until today that I pulled the 1,500 for the SSP, but that's just SSP doses. That's not all the Narcan that we're able to have through having the SSP that we give out to our community partners and our law enforcement. Any other questions that I can answer or try to answer?
Thank you, Kayla.
Thank you.
In terms of public comment, if we could have the record reflect that we did receive a number of emails that were sent to the Commissioner's office. A total of, I counted before the meeting, a total of 30, 29 in support of, and 1 opposing the program. And I guess does the board have any other questions before we offer up the opportunity for additional public comment?
Oh, Max looks like he has something.
Yes, I've got it from Facebook here. Good morning. This is Melissa from Facebook. Comments that the Gateway to Hope program is one of the best things about our county. The trust that is built during these exchanges really allows people to say yes to other services and Hep C and HIV testing. We all benefit from this work. Scott Brown requests information regarding the annual budget of this program every year.
If somebody could answer that question. I think,
So it's all grant funded. I'm not sure, she'd have to pull the number on how many grants support this. There's a grant through, Drug Free Coalition, but it's
The
not.
Health Foundation of Greater Indianapolis is $10,000 a year. We have two different grants from Drug Free Coalition that support community corrections having a recovery coach and we have a recovery coach. Those are two separate grants. There is also an Indiana State Department of Health grant that's an HIV prevention grant that we work off of. Those are all Gateway to Hope grants.
the dollar amounts on those, do you recall?
The HIV grant, prevention grant that we just got is for $95,000 for 2021. And I think, is yours 7,800? They're 74 to 7,800. Both of us get about that much for Grace for recovery coaching.
and wasn't it the Elton John Foundation that was actually paying for the actual kits themselves?
We did not get funding from the Elton John Foundation. We're not as big, but it's the Health Foundation of Greater Indianapolis that pays for
The actual kits?
supplies for the kits.
Okay, thank you. Thank you, Max, for running those questions down. Any other public comment, Max? I also have a letter from our state health commissioner, Christina M. Box, also supporting the program's renewal. So, no, absolutely.
Jason Huber, Director at Tippecanoe Community Corrections. It's my privilege to stand in front of you in support of this program. We benefit at Community Corrections directly, our participants, through Gateway to Hope, and specifically with Grace Patton as our peer recovery coach, as we continue to provide services to our participants in this area of substance abuse. She plays an integral role of being in our building to provide that support for our participants, that linkage to care that they've talked about, is immeasurable as far as what she provides, the support that she provides to our staff who have questions about connecting people to services, as well as the partnership that we have with the health department in harm reduction initiatives within community corrections. I had the honor of presenting with Amanda at a national conference in Washington, D.C. in March about what that intersection of public safety and public health looks like. And we demonstrated this model that we have in Tippecanoe County to people from all over the country who were just amazed at what we do here and how that work is done collaboratively and with the positive results that we have. So I think it's something that we should really be proud of, and my hope is that you'll continue this program. So thank you very much.
Thank you, Jason.
Thank you, Jason, and I guess I'm in agreement with what you're saying. We're looking at expanding community corrections to allow for substance abuse and mental health and treatment, and this is another element to help try and tackle those. And so, in saying that, I am in support, and so I will make a motion to approve resolution number 2020-30-CM, renewal of the syringe exchange program for 2 years.
And I think everyone knows that coming to the original decision, dealing with the program or starting the program wasn't an easy one for any of us, but I'm still very confident that the program is still necessary in our community, and I know that we're going to get on the other side of the pandemic, and when we arrive there, I'm certain we're going to see a quick jump in some of those numbers. So with that, I will second Mr. Byers' motion.
I'll just add that, it's obviously no secret that I've had some issues with this particular program. I struggle with it. One of the hardest decisions I've had to make as commissioner. I commend the great work and wholeheartedly support the work that's being done out there around substance abuse, and recognize that it's a huge problem for not only this community, but for many, many communities. And I 100% support the program that we're moving forward with in conjunction with the new project at Community Corrections and the Tippecanoe County Jail. I just, I've been in so many meetings in regard to, through my volunteer work through the United Way and through county-related projects in which we've been talking about this very, very important issue. But I still can't wrap my head around the fact that it's beneficial to give out, these kits to folks. If, at some point there can be true documentation that that there are folks that are actually getting help that are dedicated, that directly through this program, I could potentially change my mind. At this point, suppose that we have 12 people that are in recovery, which is phenomenal, but we don't really know how those folks got linked up with those services. I mean, it could just, be that, they finally reached that point where they or their family had, they may have been participants in the program, but we don't know that that's actually what made them. And what we don't know is of the other folks who are in the program, the 550 remaining folks, or whatever that number is, we don't know that they're still in this addicted to substances because of this ability to have the supplies to do so. So that's concerning. And until I can get my head wrapped around that, I just have a fundamental issue with the program in general, and I still just can't bring myself to support it. So.
Okay, so we have a motion and a second. Is there any further discussion? Those in favor signify by saying aye.
Aye.
Aye. Oh, I'm sorry.
Okay, we'll try that again. Those in favor signify by saying aye.
Aye.
Aye. Opposed?
Nay.
Okay. And the motion passes. Is there any other business to be brought before the board?
I thought you wanted to.
Why?
Oh, that's right. Amanda, we are going to go ahead and talk quickly about or I guess Doug can do it, the MOU with the YWCA for the shelter.
Yeah, I mean, if Amanda wants to go ahead, I can say what I remember. You know more about what we're doing.
So with our COVID numbers, we had to put a stop to anybody new coming into transitional and LUM for a period of time. We're not sure what that period of time is going to be. It will depend on if there's new cases that pop up. So we needed a day shelter, and the Y graciously provided that space. United Way got everybody connected that needed to be connected, and Phoenix paramedics will be the ones staffing that, and the liability goes through the commissioner. So it's kind of a joint effort. Michael Budd put everybody together in a room, and everybody kind of did their part with it, and it'll be paid for through a grant with Phoenix and part with United Way grant funding.
Okay, and this is an my understanding, an extension of an agreement that was in place but had expired?
Yes. So we had set up a safe zone shelter before. We didn't need it. And so now we're calling it the annex. And part of that is because anybody on the banned list from those two shelters will not be able to get into our annex shelter.
Okay. And I bring this to the board's attention because the shelter actually opened earlier today.
So the shelter started at 9 a.m., so it'll be open 9 a.m. to 9 p.m. It'll be in 2 to 3 hour slots, and it'll be closed an hour for cleaning. There will only be 12 participants in at a time.
Thank you, Amanda. So what I'm looking for is a ratification of the agreement that I had to sign yesterday.
So moved.
Second.
I have a motion and a second to approve the MOU with the YWC Greater Lafayette. Any further discussion? Hearing none, those in favor signify by saying aye.
Aye.
Opposed? That motion passes. Any public comment?
Mr. Bangert, I guess you're done with us in the following week, retiring? Is that what I saw? Oh. From what I saw on your Facebook, you were skipping down the street and happy or whatever, so I don't.
I'll be leaving, but not retired.
Okay. Well, thank you for your service, Dave. It's been we worked together for a number of years, and always appreciated the approach that you take to doing stories and community interest overall. And I know it's not just a place that you report on; it's your home, and that's evident in the way that you conduct business. So I hope that it's a moving on and not a farewell. I don't think that's the case, and we look forward to your next endeavors, and maybe even reading about it in the paper.
Move to adjourn.
We are adjourned.